Thank you and good morning. I'm going to take the opportunity because we have something unique, at least so far, here in British Columbia. We are one of the few places that since the early 90s has asked questions about sexual orientation on population level surveys of youth in schools and among street-involved youth. And so that gives us an opportunity to actually take a snapshot of what is the health status of gay, lesbian, and bisexual teens, and specifically for today, gay and bisexual young men in high school. So what I'm going to talk about is the population trends that we've been able to look at, as well as the health disparities that we see, sort of the outcomes of those social determinants of health that Terry was talking about. What are the contributing factors or some of the explanations that we've been able to uncover in looking at these different health issues, as well as understanding some of the protective factors in the lives of gay and bi teens that help foster resilience in spite of those inequities in the social determinants. So first I need to tell you a little bit about the surveys. The BC Adolescent Health Survey has been conducted across the province in school districts in grades 7 through 12 since 1992, every 5 years. So 92, 93, 1998, 2003, and most recently in 2008. We've also conducted a street-involved youth survey using many of the same questions, as well as additional questions related to sort of life on the streets in 2000 and in 2006. And in 2006, that was in 9 different cities across BC. So that included Victoria and Vancouver, of course, but also Prince Rupert and Prince George, Kamloops and Kelowna, Abbotsford Mission and Surrey, and Nanaimo. Am I missing one? No, I think that's all of them. So it's provided a sort of a wide range of street-involved youth. Most of what I'm going to talk about comes from the 2008 BC Adolescent Health Survey and the trend data from the earlier surveys, but I will incorporate a little bit about the street-involved youth where we have that. So one of the things to look at is just how many teens are we talking about? And among youth who are enrolled in school, the estimate is that we have almost 3,000 gay and bi identified teens in school. Now keep in mind that since sexual orientation unfolds over adolescence, and a lot of kids are not necessarily going to feel safe, even on an anonymous survey coming out, that these are sort of the conservative estimates, and we also have to remember that gay and bi teens are less likely to be in school and more likely to be leaving school, especially in grades 10, 11, and 12 because of their experiences in school. However, that does give us an idea that there's about 2 to 3% of young men in high school who are gay or bi, and another couple percent who are in the process of sort of coming to some understanding about their orientation or would be questioning. Street youth, queer kids are way disproportionately represented among homeless and street-involved youth. So instead of it being a couple percent, we see 10% of youth in our street-involved youth survey of 12 to 18-year-olds who said that they are gay or bi. So let's talk about some of those health disparities. Compared to heterosexual teens, our gay and bi teens are more likely to have ever tried cigarettes and more likely to be current smokers. And since smoking tobacco is still one of the key contributors to health and early death across the entire population, this is certainly something that should be of concern to us. While trends for smoking in heterosexual teens have declined consistently since 1992, we don't see that for our gay and bi teens. Those trends are not changing. When it comes to alcohol, marijuana, and other drugs, as you can see from this, the dark brown is hetero teens and the gold colors are gay and bi teens. They are much more likely to report ever having tried alcohol, marijuana, or other drugs, and to engage in binge drinking, that is, drinking 5 or more drinks in one episode in the past month, and to smoke marijuana in the past month, so more current use. And when it comes to the other drugs, although they're generally very low rates among kids in high school, we still have higher rates among teens. Nearly half of our gay and bi young men have tried other drugs like ecstasy, crystal meth, cocaine, heroin, etc. We ask questions about dieting and eating disordered behaviors, such as binge eating or vomiting on purpose after eating. And we see again that gay and bi men are more likely to report these behaviors than heterosexual teens, quite a bit more likely. Similarly, some of the other risks that affect those social determinants of health, having housing and income, we see gay and bi teens are more likely to run away. Part of that question becomes, do they come out and get kicked out? It's hard because of the way we ask the question on the school-based survey whether or not their running away is actually voluntary. But among our street youth survey, we find that gay and bi teens are more likely to both run away from conflict at home as well as to come out and be kicked out than their heterosexual teen peers. We also find that for the first time, we asked in 2008 a question about self-harm on purpose without intending suicide, so cutting behaviors or other kinds of self-harm. And we find that gay and bi teens are 6.5 times more likely than their heterosexual peers of the same age to report self-harm. We also ask about emotional distress, so feeling hopeless or a sense of despair, as well as feeling stressed out and feeling really sad. So questions that relate to emotional distress, depression, anxiety. And we find that gay and bi teens are more likely to report these. No surprise. And I'm sure you've all seen the data for years around issues related to thinking about suicide and suicide attempts. And we see again in 2008 that gay and bi teens are more likely to report thinking about suicide in the past year and attempting suicide in the past year than their heterosexual peers. And I've got a couple figures to show you on that. Here's the trends since 1998, so just the past 10 years, looking at suicidal thoughts. And as you can see, the heterosexual young men, it's about 10%, and it's generally considered unchanged, that 9, 10, 8%. And our bi and gay teens, way higher, and they've been consistently higher. But we've also seen that where there was a decline among gay youth in 2003, they're bumping up again. And where there was an increase among bi youth in 2003, they're staying steady at that rate. And both of those rates are quite a bit higher than among the heterosexual teens. Similar and even more concerning trends in suicide attempts. We saw a decline in 2003 among gay and bi young men in reporting suicide attempts in the past year, and we were excited about this. It's like, yes, okay, something good is going on. Unfortunately, that has reversed, and in the last 5 years, they actually have a higher rate of suicide attempt than they did 10 years ago. So there's something going on, and we need to be paying attention to that, especially since in the general population, for the first time ever, suicide attempts have dropped. The rates had been steady since 1992, and now they declined. But that's not the case for our gay and bi teens. Let's talk about sexual risk in teen pregnancy. I'm not going to go into great detail about HIV risk because I think there are a lot of other discussions that will be happening around that over the course of the summit. But just to sort of call attention to some of the other things that are happening with gay and bi teens. Clearly, the number of teens who have first sex before age 14, which often is unwanted, or sexual abuse, is higher among gay and bi teens, as well as self-report of actual sexual abuse is disproportionately higher for them. Using alcohol or drugs before last sex was also higher. Having more than 2 sexual partners in the past year, higher for gay and bi young men than for heterosexual teens. Bi youth, but not gay youth, were less likely to use condoms at last sex compared to heterosexual teens. Both gay and bi young men are 2 to 5 times more likely to report having caused a pregnancy than their heterosexual peers of the same age. And this is a phenomenon that we've seen since 1992, and that gap is not changing. They're still 2 to 5 times more likely to be involved in teen pregnancy. And among street-involved youth, they're more likely to trade sex for money, for drugs, and for other goods, what we would call sexual exploitation among those who are under age 19. So, not exactly a happy picture. We see persistent disparities compared to their heterosexual peers. For us, that's not enough. The question then becomes, okay, what explains this? And one of the things that's come up again and again in the research that I've done in the past decade and a bit is stigma. Gay and bisexual teens are disproportionately more likely to be targeted for exclusion, for harassment, for outright violence in the family, in school, and in the community compared to their heterosexual peers. And when we actually account for that, when we account for whether they've been abused or when we account for whether they've experienced bullying, that explains a whole lot of the difference in the rates of their health disparities. So when we looked at suicide attempts, we found that sexual abuse and physical abuse explained a lot more of suicide involvement than being gay did. It's the fact that more gay youth are experiencing that kind of family rejection and that kind of violence in the community that explains part of what's going on. We also have asked since 1998 a question about discrimination because people thought you were gay or bi on our survey. And no surprise, heterosexual kids are far less likely to report that they've been discriminated against on the basis of, because people thought they were gay or bi, but there are some who do report that. And because the heterosexual population is so much larger than the gay and bi population, that tiny percent actually ends up being a really large number, so that if you just looked at how many kids are actually harassed because people thought they were gay, most of them are straight, or at least identify as straight. And what we do find is that if you've been harassed because people think you're gay or bi, that homophobia, even if you're heterosexual, still has an impact on your health and risk behaviors. Let's look at some of the trends in reporting discrimination because people thought you were gay or bi. Unfortunately, it's not getting better in BC schools. And this is something that's of concern. We see, although among the heterosexual teens it's kind of flat, 3 to 4% is not enough to really make a difference. When you look at gay and bi teens, the rates are increasing. So we do need to look at how that discrimination is happening. Now, the question is not just asked about in school, but rather in the wider community as well. But it is something for us to be aware of. But I do also want to really let you know the picture is not all grim. We find that on our survey, we don't just ask about the risk behaviors. It's not just sex, drug, and rock and roll. We also ask about positive aspects of people's lives, their health behaviors, the things that they're happy about, as well as protective factors, supportive environments that have been shown in the general population to foster healthy youth development for all teens. I also want to remind you that even though we see higher rates of most things in terms of health risk behaviors among gay and bi teens, it's still not the majority. Very few of those stats I showed you were 50% or more. So let's remember that the majority of gay and bi teens are actually navigating their adolescence in healthy ways, and even if they're exposed to discrimination and violence, they're still doing pretty well. And some of that is they have assets in their lives. So looking at that, we actually have the question of being able to ask about those protective factors. We know from some of the research we've done with the 2003 data that gay and bi young men report lower levels of those protective factors. They're less connected to family, they feel less support within their family, they're less connected to school, they feel less safe at school, they have fewer supports in terms of friends or adults outside the family that they can turn to. But when they have those protective factors in their lives, there are positive things. And so this is one of the other things that we've looked at. When it comes to family connectedness, those with high levels of family connectedness are less likely to report all of those risk factors that I've just told you about, including the substance use issues, self-harm, and suicide. Significantly less likely. So the kids who have the highest levels of connection compared to those who have the lowest levels of connection, 95% less likely to attempt suicide in the past year. That's a huge difference. And even among those who've experienced sexual abuse and violence and harassment in school, when they have supportive and caring family members, they are less likely to attempt suicide. We see similar things with our school connectedness. Among those who feel like they are a part of their school, they like school, they feel like they belong, and they feel safe at school, those with high levels of connectedness are less likely to smoke, to drink, to use other drugs, to engage in risky sexual behaviors, to be teen parents, to attempt suicide or self-harm. And those rates decline by as much as 90 to 95% among those who have the highest levels of connection at school compared to those who don't feel connected at all. So, bottom line. Gay and bi teens across the province in both rural and urban schools experience higher levels of discrimination, harassment, exclusion, outright physical assault than their heterosexual peers. As a result, they're engaging in riskier behaviors that actually can compromise their health down the road or shorten their lives quite immediately. However, not all of our gay and bi teens are engaging in these risk behaviors, and protective factors in their lives help buffer those risks and that harassment and stigma. So I guess the questions I would ask all of us here as we're sort of pondering this in the summit is, what are we doing as a community, as a society, to help reduce stigma and discrimination for gay and bi teens, especially in schools? And how can we help improve family support and school connectedness for these young people? Thank you.